Welcome to DermWire News, powered by PracticalDermatology.com. I'm Stephanie Talea. Dermatologist Dr. Jonathan Silverberg and sleep neurologist Dr. Hirayer Atarian were named Patient Care Heroes by the American Academy of Dermatology for teaming up to provide coordinated multidisciplinary care to patients with eczema. Both physicians practice medicine at the Northwestern Medicine Multidisciplinary Eczema Center in Chicago, which Dr. Silverberg formed in 2013. Dr. Silverberg had considerable experience treating patients with eczema prior to launching the clinic, but recognized that uncoordinated care was a major obstacle to providing patients with the best possible care. People with eczema experience an array of symptoms that cross medical specialties, including difficulty sleeping due to itchiness, creating a vicious cycle of poor sleep and increased inflammation. Because itch affects both eczema and insomnia, treatment often requires a multidisciplinary approach involving allergists, neurologists, sleep specialists, and dermatologists. Dr. Silverberg recognized that outcomes would improve if specialists consulted together rather than relying on patients to coordinate their own care. I had patients who were seeing me for their skin disease, someone else for their allergies, and someone else for primary care, Dr. Silverberg says. There was no coordination between us, and as a result, there was a lot of mixed messages. To improve coordination, Dr. Silverberg and Atarian now offer patients a single, comprehensive 2 to 3 hour appointment. This allows physicians across different specialties to confer in real time, ultimately creating a comprehensive treatment plan and providing a better experience for patients. It is incredibly rewarding as a physician to work as part of a team and see how this coordination improves care we provide to our patients, Dr. Atarian adds. For one eczema patient who has difficulty sleeping, we used a combination of light therapy and melatonin to naturally adjust her sleep cycle, which reduced her inflammation and itching. The AAD created the Patient Care Heroes program to recognize physicians who transform patients' lives by utilizing their experience and collaborating with other physicians to treat serious skin disease. Diseases don't neatly align with individual medical specialties. They require care from multiple clinicians, and it's crucial that our care reflects that, says Dr. George Harusa, president of the AAD. The approach practiced by Dr. Silverberg and Atarian is more efficient for physicians and, most importantly, more effective for patients. The Know Now testing program is an initiative from Novartis in collaboration with Quest Diagnostics that offers genetic mutation testing at no cost for all patients with stage 3 or stage 4 melanoma. Nearly half of all advanced melanoma patients carry a specific mutation called BRAF. BRAF status is key for assessing treatment options. Results from tests completed under the Know Now testing program are available approximately 48 hours after Quest Diagnostics Laboratory receives a sample, which could lead to timely and optimal treatment decisions, Novartis says. To access the Know Now program and its no-cost testing, healthcare professionals should visit KnowNowBRAF.com and download the BRAF test request form. At Novartis, we know that understanding potential mutations is critical for melanoma patients and their doctors to make informed treatment decisions, says Amit Malik, Executive Vice President and Head, U.S. Novartis Oncology. We recognize the barriers that often keep patients from being tested. That's why we're empowering the melanoma community with this Know Now testing program. People diagnosed with stage 3 or stage 4 melanoma can ask their doctor about BRAF testing and the Know Now testing program to access its no-cost testing benefit. Healthcare professionals can also visit KnowNowBRAF.com. Thank you for listening to DermWire News, powered by PracticalDermatology.com.